Good morning, America. This is Rickredalen, the Maverick Doctor. I want to talk to you a little bit more about what it's like to have a critical illness in your family and you can't get help anyplace. Now, I've been a physician for nearly 50 years. I graduated in 1968. And you would think a doctor is able to get good health care for his family, wouldn't you? And that is simply not true. You would think the wealthy can get good health care for their family, wouldn't you? That's simply not true. They do have one advantage: money. At least they can pay their deductible. When I was on the campaign trail driving around my great big 42-foot RV, I wasn't driving it myself, thank heavens, but when I was making the rounds of the states we needed to win to get a Trump presidency, I talked to literally hundreds of people. I had one girl in an Ohio truck stop who walked up to me and pointed at me and then pointed at the side of my bus, and she said, "That's you, isn't it?" And I said, "Yes, it is." And she started crying, and she gave me a hug, and she said, "Thank you for what you're doing for us." I don't know what I'm doing for you. I'm trying to do something. I don't get paid for this. I'm not looking for a handout of any kind. The wealth that's been provided me through some of my endeavors is being used to help you people. All of it. It is all being given away. And I need you to know that not everybody out here in the medical profession is going on their own road and going their happy own way. Most of our physicians and nurses today are extremely unhappy. Patients are really unhappy. You get in a hospital today and a nurse, you see all these patients wanting help, and nurses are playing with their little palm phone and different things, doing the computer work. Patients are just, what are they today? I think all of us patients, myself included, we're kind of just an unnecessary thing that it would be good if we could just sit with our computer all day long, do everything, and just have something probe around on the patient so we didn't even have to walk in their room. That's kind of what our healthcare has gotten like. When I watched my little Lori in the hospital gradually dying and our healthcare system not doing anything about it and just saying, "Oh, she's all right, her laboratory and x-rays are fine," I still can't get over that today. When I started practicing medicine in 1969, we did physical examinations on patients. We talked to them. We sat at length talking to our patients. When I made rounds in the hospital, I went in and sat on my patient's bed. I held their hands. And that connection was important. It was a rare day when I couldn't walk out into my waiting room and say hi to all my patients by their first name. It wasn't uncommon that I could ask most of them about how their aunt and uncle were doing at home, or how their grandpa and grandma were, how their parents were, how little Johnny and Susie were. We knew our patients. Today that does not happen. And the disconnection that doctors have with patients today hurts healthcare. Does a doctor care if one of the patients in their clinics dies today that they maybe have seen once and that patient's been spread around another 20, 30 doctors? I doubt it. It's not any different than reading an obituary. Yeah, so our patient died, so what? Well, we'll get more patients in, we'll have other revenue. Now, do doctors really think that way? No, they don't. But it seems to all of us patients out there that they do. When I think of the way I practice medicine and what a blessing it was and how it made my heart feel good every day to go home and say, "Today I did something good. I took care of people." It's the greatest blessing a physician can have, is to care for people. All of you people place your trust in us doctors, and we are supposed to return that trust and give you the reasons why you have that trust. Today that does not happen. Many of the older physicians are sick about what's happened to medicine and what is happening to it. The young doctors I talk to say, we'll never be able to practice medicine the way you old doctors can. And I agree. They're not taught how. They're just taught how to order tests. Order hundreds of tests. And the beam counters who have hired them love this. The more plates and screws an orthopedic or neurosurgeon can put in you, the more he gets paid. And the more the hospital makes. Wow, that's great for the shareholders. What's it do for the patient? Well, it gives them second-rate care. Why do we put all these plates and screws in everybody and other countries are able to do it more naturally? Why? Because we're paid to do it. We're paid to do it. Doctors can't go out and start out in a solo practice anymore. They can't afford health care insurance. They can't afford to get it started. They're burdened down with massive debts. For the first time in the history of America, doctors tell their children, do not go into medicine. There are nursing shortages all over. There are doctor shortages all over. These are going to grow worse because our young people that want to enter the healthcare profession see what disarray it's in. Why would you want to enter that? Medicine and education used to be two of the most respected professions in the world. Not anymore. We're kind of like a couple of dirt lumps bouncing together that people get exposed to because they have to. No more do patients go to their doctors because they just love to go in and say hi or watch them do a magic act or all the things doctors used to do to get a connection with their patients. Tell your doctors what you want. Many of them will listen. There are many good doctors out there yet, and many of them just need to be pushed so they can push back on these gigantic money-making corporations. Please help with this. This will not happen without you, the American people. Please help. God bless you. You have a blessed day.